Thank you for joining us today to learn about a new benefit available to our U.S. employees from Aware Health. Aware Health is a free, no insurance required, voluntary, confidential, virtual, same-day physical therapy service that treats muscle, nerve, and joint pain for you and your dependents. With us from Aware Health, we have Dr. Heidi Oja. She has been a clinician, professor, and now top-cited publisher in the world on direct models to simplify care for muscle, nerve, and joint pain. She founded Aware Health to provide a better option for employees like you. Dr. Oja, thank you for speaking with us today. I'll turn it over to you.
Thanks, Allegra. Hi, everybody. I'm so excited to talk to you today. And the reason is that I started this company a couple years ago. And the reason I started it is to really simplify the pathways to get care for orthopedic pain. And I've been in the system for 20 years as a clinician and have seen the complications. And I am just trying to start this company to roll it out, simplify the process for you, make it cost effective. So this is a free service, like was mentioned, for you. And we're really open to feedback in this initial phase because we want to really understand, is this a simpler process for you? And if it's not in any way, we want to hear feedback from you to understand how we can make it even simpler. So for this presentation, we're going to cover three things. We're going to cover who we are. We're going to cover 3 benefits to you and your family by using the service. And lastly, we're going to listen to a few testimonials of employees who've used our service. So recently, hopefully you got a pamphlet in the mail like this. You should keep the magnet in the health packet in your wallet, or it's magnetized. So if you have a magnetized fridge, you can keep it on your fridge. And whenever you need to schedule, you can just scan that QR code located on the pamphlet or the magnet. So if you're having difficulties with the QR code, not sure how to do that, you can just go to evraz.awarehealth.io. And again, it's evraz.awarehealth.io. So if you just type that into your Safari or Chrome browser, that'll come up with a sign-in page to sign up for our service. So we'll go into how this will actually look once you connect with our provider. But first, I just wanted to share some of the most common conditions that we treat. Some of them are a little atypical, so I'll go through them in more detail. We treat jaw pain, lockjaw, or any clicking, even if it's not painful in your jaw. We treat carpal tunnel syndrome, even if it's progressed to weakness in your hand. We treat joint pain, even if it's bone on bone. And we treat pelvic floor because the pelvic floor is essentially a muscle like a hammock in your pelvic outlet. And sometimes before or after labor or much later in life, when you cough or sneeze or jump, then you experience some leaking. And so we treat that to strengthen your pelvic floor. And we even treat toe pain. So turf toe or any variation of foot pain or toe pain. We also treat mental health, including pain related to burnout, fear, depression, or anxiety. And we treat health and wellness, like moving better or improving your abilities. We even help you set walking or running goals for speed or strength and improving your respiratory capacity. So we treat long COVID or any respiratory related issues due to COVID as well. So before we start with who we are, this is what it looks like when you scan the QR code to sign up for your appointments. The same QR code that's visualized here can be found in every single slide in this presentation. So if at any point you're ready to sign up, feel free to just use that QR code on that slide. And if you'd rather, you can also just type in this link. Again, I have it listed here. You don't need to type in the HTTP. You can just put evraz.awarehealth.io and it should come up with this initial page here. We have you verify it with your cell phone so you don't have to remember a passcode. And we encourage you to also share the QR code or link with your family members. And you can give them like the best gift by helping them decrease their pain and get back to living more. They do need to use their own phone to sign up because all the text messages with the program go to that phone number that's initially entered in. So if you want to sign your family members up, make sure to send them the link of Evraz.awarehealth.io or take a photo of this QR code, and then they can use their phone to scan it off of your phone or text or however you send that to them. At the end, we'll show you how to accept the calendar invite you'll get in your email for the Zoom link to join your clinician appointment. So when you log in and scan the QR code, you want to go all the way to the end and choose a date and time to meet with your provider live over a Zoom call. And then that's how you log into the Zoom calls with this link in your email. Okay, so here's what to expect. You log your problem virtually, get an appointment right away. There's no time wasted driving to your appointment or waiting to be seen. It's free care, so there's no copay, no deductible at any time. You'll be treated by doctors of physical therapy or physicians who specialize in orthopedic care. You can build rapport because you see the same clinician for each appointment. It's not like teledoc or telehealth where it's a phone service, no video, you see a different provider every time. It's a live video call, 25 minutes, and you see the same provider every time. This is our 3D model we use to explain your diagnosis. Oftentimes, I find that patients coming in assume they need imaging, but most of the time, the diagnosis can be made without that step. If you do need imaging, our specialists call it in for you the same day. So this is what our back end looks like. You don't actually see this, but our providers have a whole list of pre-recorded videos, and we customize a program based on your evaluation that can help you on your personal journey back to health. The personal treatment plan then arrives in your phone, and you can communicate 24/7 with your provider. Your plan changes as you progress, so it's in constant evolution. So far, we have a 96% Net Promoter Score, which shows employee satisfaction, and 90% rated this virtual service getting the same or better results than in-person care. And we attribute that to the convenience of having a specialist on your phone. And also, we really listen for 25 minutes. Typically, a physician will give you 3 to 10 minutes of their time to understand your problem. So we really listen and try to customize a program that gives you a better diagnosis, quicker results than the traditional system. So now let's go over 3 benefits of using us. The first benefit is that we treat versus manage pain. In other words, we're not a pain management service. We actually get to what's causing your pain and then help you treat those causes. So it's never too late. Oftentimes you think pain is from arthritis, degeneration, anything that shows up in your imaging when you use your typical insurance provider. But what you see on imaging is often not related to your pain. And what is related might only take 1 to 4 visits to actually treat and resolve your problem. So let's go through this next slide to give you a better sense of what I'm talking about. You might think that what shows up on imaging is your diagnosis. And you can see a couple examples of that here. There's disc bulge up top and a disc protrusion in your lumbar spine or lower back. And these are 2 common findings on imaging that radiologists look for. But in this study, people without any pain had these findings on imaging. And so all of those that were imaged in the study had no back pain. So just take me for an example. I'm in my 40s, and there's a 50% chance. So you can go to the column where there's 40s here. There's a 50% chance that I have a disc bulge and a 33% chance I have a disc protrusion without having any back pain. Oftentimes, imaging results are misleading and don't correctly identify the causes of your pain. So by seeing a wear, We know what is relevant and what isn't. You can find your age on here. If you're curious, if you're 60, you can follow how likely it is to find these findings on your imaging if you were to get an MRI of your back. And just to kind of stress that these imaging findings are really normal for you. It's just kind of like gray hair. As we age, our imaging changes. And we shouldn't be too quick to assume that these findings are the cause of our pain. The second benefit that we teach you is to how to be active without flaring up your pain. This means you won't need to put your life on hold to get better with us. For example, we teach you the right way to do a task, like lifting without back pain or running without knee pain, within your limits, so we help you achieve more to progress to doing that activity fully again. Our tagline for our company is live more. So we really want you to live more and get back to your life. I think one of my biggest pet peeves when I've shadowed physicians or other physical therapists is that if the knee hurts when running, the most common recommendation is, well, don't run. But what if that person likes running? Or what if that person likes picking up their grandkids despite having back pain? Then that's not a great solution to just stop doing that activity. So instead of saying don't do that, we teach you how to do it, but without pain. Hold on. Okay, thought I went to the next slide there. So this is just a little bit more clarification. Some might get an MRI for back pain and see a disc herniation like shown here and be told to not lift to avoid back pain. And you can see the black visualization of this disc herniation, and you might be able to appreciate it even more by looking at the spinal cord. So in this picture, you can see the spinal cord is discontinuous in this spot here, whereas on this normal MRI, you can see it continuous. So this disc herniation is visible here. And with a progressive return to lifting program and understanding it is safe to lift and the spine is resilient and strong, this patient had complete recovery of their herniation as shown by the continuous cord here. So this is a year later, the second MRI taken. And our bodies are constantly healing. As long as we don't put blockers up to impede our healing, our body's really good at healing. So if you develop fear avoidance and you're scared to lift and you kind of stop moving in life and interacting socially with others, that could be a blocker for you getting better. And so what Aware Health does is we know what findings are relevant or irrelevant on imaging, and we help to remove those blockers so that your body can heal and you fully return back to living life again. And typically, you do not need surgery to live fully again. Our bodies heal if we resume life like living without fear. So the third benefit, and this is probably the biggest benefit to you, is that we are the free quick fix to your problem. The medical system is scary. You never know how much something is going to cost when you go in for an appointment or a procedure or an image that's ordered. And you can have this assurance coming to us that you will never pay anything for our care. The only times, or if we refer you to your insurance for something, and that could be if we suspect cancer causing your back pain, or if we do think an MRI is necessary, then it's hard to do that over a telehealth platform. So then that would go through your insurance. But most of the time people think they need imaging and don't. So we can save you the full cost of your imaging by using our platform. So just to understand a little bit more why we're the free quick fix, there are two typical routes that I commonly see when you go through insurance for an orthopedic issue. The first is a surgical route, and either one of these two routes that I'm going to show you, the treatment doesn't start until 2 weeks after you enter the system. And that's a problem. That's too slow. We want to start treatment the same day. So for the first pathway, that I commonly see. It's the longest pathway. You might see your primary care provider for your problem. You might need an x-ray, get a follow-up visit to look and discuss the x-ray results, or order an MRI at that point. You might get referred to an orthopedic surgeon. You might get 1 injection, 2 injections, 3 injections. If that doesn't work, then kind of the obvious is surgery. And then you still need to do a rehab program after surgery, oftentimes. Another common pathway that I see a lot is just the medication pathway. So you go to primary care, you get prescribed non-opioid medication like naproxen or Flexeril or something like that. And then you have a follow-up. And if you're still not better, maybe they'll prescribe opioids. All of these medications, opioids and non-opioid medication, have side effects that sometimes can really prevent us from living our life fully. And then obviously opioids are addictive and sometimes rehab's needed, behavioral counseling. It's just a long road and we don't want you to go down that slippery slope. So instead, we're offering this as a day 1 service to begin treatment. So we identify the causes of your pain instead of covering them up with medication. And if we do need medication along with identifying the causes, we can prescribe that as well. But within 1 to 4 visits, pain typically resolves. Our average is about 3.7 visits, I think, per case. So we are the quick fix to your problem. Do not get tangled up in the medical system. Definitely reach out to us first. Even if you're like, I know I need surgery for my problem, I'm going to get on the surgical waiting list. In the interim, how does it hurt reaching out to us? We can give you a different plan and no time is wasted. And maybe you can cancel that surgery if you're fully better by the time your surgical date comes up. So it's never a bad idea to try us first. Even if you you think you fractured your ankle, instead of going to urgent care or the ER and you're in excruciating pain, call us first, because if we can confidently rule out that you do not have a fracture, it saves you all of that time and waiting in the ER. Or maybe we can give you pain control for your excruciating problem while you're just at home, and it will save you a huge amount of cost and time on your side. So when you seek care, this is what happens. You get a 25-minute live appointment, and you'll meet with one of these team members who will give you care that is 100% protected by HIPAA. So we cannot share anything you tell us with your employer. Here is Dr. McDonald, and she's a clinical specialist in our team.
Hi there, I'm Dr. Siobhan McDonald. I am a physical therapist and clinical specialist at Aware Health. I live in Colorado and love exploring it here with my dog. I look forward to working with you.
And this is our orthopedic surgeon, Dr. Romero.
Hello, I'm Dr. Denise Romero. I'm a board certified orthopedic surgeon. I've been practicing for over 10 years. I have extra specialization in sports medicine. I have been working with Aware Health since it was founded, and I'm happy to help in any way I can with any surgical and orthopedic needs that may arise.
And our providers are located across the country. This is a handful of them. And we're open 7 a.m. to 7 p.m. PST, Pacific time. And we're also available outside these hours. So if you look in the schedule and you don't find same day availability, then I'm asking you to either text or call this phone number, 925-444-0561. You can pause this presentation and just take a moment to enter this phone number into your cell phone. So that way, if you're not by the magnet where you have the QR code at home and you're on vacation in Mexico or somewhere, then you can just call us for an immediate opinion versus not having that information on you. We're open also outside of these hours and over the weekend and holidays. So this is a phone number that you can call or text at any time. And you should also give this phone number to your family or your dependents so that they can keep us on their phone as well.
Hello.
Okay, so here's the info to schedule again with a QR code. The QR code is located right here. If you can't scan the QR code, just use the link. Again, that's evraz.awarehealth.io. And as we go through these employee testimonials or experiences, feel free to schedule this appointment with us if you haven't yet with the QR code or the link. This is a testimonial from Becky Call, who coordinated this whole program. And Evraz is really paying for this program so that it's free for employees. So any of the free care you're getting is really because Evraz decided to sign you up for this perk. And her experience was, I've had pain from plantar fasciitis for over 10 years now and have seen numerous providers. What sets Aware Health apart is that in addition to diagnosing the cause of the pain, we set 3 personal goals I'd like to accomplish. And these goals were walking, standing for 3+ hours without pain, and being able to do exercise for extended periods. And then we determined the course of treatment to get there. Instead of just giving me a printed sheet of paper with some stretches and saying, good luck, I was sent videos that walk me through the recommended stretches step by step. And I get daily text messages asking me if I did my stretches to keep me accountable. The stretches only take 5 to 10 minutes a day, so I don't have an excuse to not do them. So this was Becky Call's experience, and we really tried to make it super simple. So it's not a whole laundry list of things to remember to do. Here's another experience from an employee.
Hi, my name's Robert. I just wanted to take a minute to give a big shout out to the Aware Health team. Having driven commercial vehicles, operating equipment over the past 30+ years, it's really taken a toll on my shoulders and my neck. About 6 months ago, I was having a lot of pain. Went to the doctor. He said, take 800 milligrams ibuprofen. Here's a referral for an MRI. You're probably going to need surgery. It's like, oh, great. So I went home, was talking to my wife, said, hey, you should try this new program through our insurance called Aware Health. They might could help you. So I called them up, got an appointment. About 6 weeks ago, I started the program, and it's been remarkable. I can raise my arm above my head. I can steer the forklift. I can steer the steering wheel. All these things 6 weeks ago I couldn't do. I mean, I had a dead arm. I was kind of doing the dinosaur thing. That's all I could do. So anyway, just wanted to give them props. They really know what they're talking about. Great people, great program. Have a nice rest of your day.
So this is an example of an employee who actually had a rotator cuff tear and was able to completely get his full strength and range back without surgery. And I just also want to share a second testimonial, only because I feel like when you think about a one-stop shop for orthopedic pain, you think about injuries or tears or herniations, but we also treat preventative care or mental health and physical well-being. So there's another testimonial that highlights this that I'll.
Hi, man.
I found out about the Aware Health program at one of my company's safety meetings last year. And it seemed like a really great program because of how flexible to attend. In my line of work, we are living out on the road and we're rarely home. Doing an in-person meeting is nearly impossible. So it was really, really helpful that you could do this on your phone or a computer just about anywhere if you have connection. I have far less back pain than when I started, and I'm no longer smoking cigarettes. For quite a while there, I was really seriously thinking about looking for another job and quitting this line of work due to how stressful it was. And thanks to Aware Health, it was really, really helpful in finding ways to, I wouldn't say cope with it, but have a whole new outlook on, coming to work and enjoying this job. And yeah, it was a big help in dealing with the stresses that come with this line of work. I'm now still working at the same company, and I got a seat at this table, and I'm not getting up for anybody.
So I remember personally working with this employee, and it was just like one of his goals was to quit smoking, but he's like, well, I have to quit my job to quit smoking. But then he couldn't use our service if he quit his job. So I was like, okay, well, let's kind of understand a little bit more what's contributing to your work stress. And through understanding that, we were able to develop some strategies to deal with that frustration, and then not as much need to smoke anymore. And so he was able to get off of smoking, and I stayed in touch with him for about 8 months after that, and he had still quit smoking. So I was really proud of him for that. And we're just trying to identify kind of the low-hanging fruit of what you think could make a big difference in your life from a health and wellness perspective. And then you set your own goals of what you're ready to tackle or not, and we're just supportive to help you reach those goals. Okay, so once you use the QR code and type in the link, you're going to get an email to that email that you enter on the platform. And I would recommend using a work email if you have one. If you don't, you can use a personal email, but that way it'll show up in your work calendar instead of not getting that reminder. But if you don't have a work calendar, then you can just go to that email and look up the Aware Health appointment, and then you can accept that appointment, and you'll see the Zoom link in the blue hyperlink underneath of that email. That's what you click on to join. If you're joining through a laptop, it should be pretty easy. You can just say join meeting now. If you're joining on your cell phone, you might need to download Zoom first on your apps. And if you download Zoom, then you'll be all ready for the meeting. If you're not sure how to do that, just our provider will call you within the first minute of your appointment to help you get online and connected. So not a problem. We meet you for, wherever you're at, we try to meet you there. Okay, so again, just a reminder to pass this on to your spouse and your kids 12 and over, who will be allowed to get on this platform free of charge, no surprise bills, no copays, no deductibles. If you have any further questions, feel free to reach out to our email, getwell@awarehealth.io, and you can address your email to our point contact for this program, Jessica Warner. And if you just say, hi, Jessica, and then ask your questions and send it to getwell@awarehealth.io, then she'll get back to you right away. Our email is a HIPAA compliant system. So anything that you send will again be strictly confidential and will not be shared with anyone. So if you have a personal question that's a little bit sensitive in nature, don't worry. You can share any of that with us on our secure email platform. Although we're no longer offering a gift card for participation at this point, most who do our program don't even care about the gift card once they start getting their life back and living more with our support. So make sure to sign yourself up, your family, if you haven't already, and feel free to reach out with us, to us with any feedback, as we mentioned, to make a great program even better for you. All right, thanks everyone.